This study brings evidence that mandibular movements are a reliable, non-invasive alternative to esophageal pressure for measuring respiratory effort in obstructive sleep apnea. Differentiating obstructive and central sleep-disordered breathing is highly recommended. We know that the activity of upper airways muscles attached on the mandibular jaw reflects the activation of the brainstem respiratory and sleep centers. This muscle activity triggers specific mandibular movements that might represent a non-invasive tool for measuring respiratory effort during sleep. Mandibular movements measurements with Sunrise technology were compared in this study to the gold standard method for assessing respiratory effort, the esophageal pressure in terms of amplitudes and in terms of cycle-by-cycle variations during a variety of central and obstructive respiratory events. In laboratory, polysomnography supplemented with a catheter to record esophageal pressure concomitantly to the recording of mandibular movements with Sunrise technology was performed in 38 consecutive obstructive sleep apnea suspected patients. Periods of normal and disturbed breathing were scored in the polysomnography blindly to the mandibular signal to collect numerous fragments that were secondly compared to the concomitant timestamps of mandibular movement sequences. An enveloping algorithm was applied to determine the lower and upper bound of the signal amplitude. Next, peak-to-peak distance, which means the signal amplitude, was calculated defined as the difference between upper and lower bounds. The final database contained more than 8,000 fragments of 7 breathing labels, their peak-to-peak distance, timestamps, and patient ID to proceed to statistical inferences between the two inertial units of Sunrise and the esophageal pressure. The amplitude followed the median of both signals, esophageal pressure and mandibular movements, reflects very well the respiratory effort across central and obstructive events and for apneas and hypopneas. Obstructive events were characterized by higher values across all quartiles and a wider range of mandibular movements amplitudes compared with central events. We examined the time series of both signals with the longest common subsequence algorithm to measure similarity between the two biosignals. And we found very similar and synchronized patterns. The long common subsequence score was about 0.8 during all type of events between the pattern of mandibular movements and esophageal pressure. This fragment of 5 minutes shows a long period of increasing respiratory effort-related arousal with a high level of similarity and synchronizing between the two signals. Non-invasively recorded mandibular movement signals are highly reliable for measuring respiratory effort during normal breathing and during episodes of obstructive and central respiratory disturbances. In a context where sleep medicine is currently facing a need for inexpensive and simple ambulatory methods of diagnosis and monitoring, the analysis of mandibular movements provides a robust signal for respiratory effort measurements.